Welcome to a very special edition of Health Matters. I'm extremely pleased to be back hosting today's show on obesity, and our plan is to stop the diet madness. My name is Jack Jawitz, and I'm a physician, board certified in dermatology, specializing in the treatment of skin cancer. But today with my guest, we will show anyone who wants to lose weight a method on how and why and how easy it will be to do so. We call it Hypnosize. You will learn why you've not been able to lose weight in the past, why your last diet has failed you, especially as you may have lost weight and then gained it all back. If this sounds like you or someone you know, call them to watch this show today, and we'll all lose pounds together. First, I'm going to introduce our two guests. We have with us today Dr. Gus Araujo, a Bradenton physician, and Adrienne Weir. We'll start with Gus. Gus, welcome to Health Matters, and why don't you tell us a little about yourself?
Nice to be back, Jack. I'm Gus Araujo. I am also a board-certified physician. My area of practice is internal medicine, acupuncture, and anti-aging medicine.
And how long have you been here in Bradenton now?
In Bradenton since 1996. And you were the first doctor that I met in Bradenton, if you remember back then. That's when I was tall and handsome. Remember that?
You're still tall and handsome.
Oh, gosh.
I'm glad to have you today, and one of the reasons I brought you is in addition to internal medicine, you practice alternative
Correct.
Medical programs.
Correct.
Why don't you tell us a little about the alternative medicine that you practice in your office?
I do acupuncture. Acupuncture, as many know, is an ancient art that is quite fascinating. Have used it very successfully in addiction, which food falls into that same category. And you stimulate parts of the brain that help to curb the desire for whether it be alcohol or drugs or food. I also do hormonal testing and protocols to help people. If you're not balanced hormonally, well, guess what? Your body is not going to function properly, and therefore your metabolic connection is off.
So you're very familiar with obesity, the treatment for obesity.
Definitely.
And more important, many of the comorbid effects of obesity.
The World Health Organization classified obesity, and there's 3 tiers. It's not just obesity. There's obesity level 1, 2, and 3. And this is based on the body mass index, which is a mathematical formula of the person's weight over their height. Now, what is fascinating is that for decades, since the World Health Organization was established, hunger and infectious disease were the #1 problems plaguing the planet. And guess what? Those are no longer 1 and 2. Obesity is the #1 problem in the world now, especially in the westernized countries. The U.S. has over 200,000 deaths that are directly related to obesity.
We're going to talk about the cause of death from obesity and the comorbid other diseases. And comorbid means when you have one disease, there are accompanying other problems with that disease. And obesity has dozens of comorbid other diseases that cause death or cause premature death. So we'll talk about that in a little bit. But right now, our Hypnosize program is going to start, and we're looking for some volunteers from you, our audience. And if you're overweight, if you feel you would benefit, I'll tell you a little about the Hypnosize program. And there are many causes of obesity, and often the root cause can stem back from an incident that happened in your childhood or sometime in your life to cause you to gain weight. And by addressing the root cause, we can reduce your urge to eat, and you will shed pounds. And we will be doing that through hypnosis, acupuncture, many other non-medical interventions. And it's an 8-week program. We're looking for 6 volunteers to participate in losing weight through this non-medical hypnotic or acupuncture intervention. We want people that can be available for 8 weekly sessions. We're not your physicians. You'll have to have your own physician who will sign off on your participation in this program. We have the paperwork for you. It's easy. The sessions will be reviewed by us. They'll be reviewed by the television station, and they will be possibly re-aired in the future as a short television series introducing other people how they can lose weight. So we'll get back to the criteria to join us for Hypnosize, and it has to do with what size you want to be, and we can get you to whatever size you want to be through hypnosis or acupuncture. Gus, tell us about some of the reasons people gain weight.
Well, there's emotional, it's a triad. There's emotional, there's traumatic, and there's metabolic. Emotional, you have, for example, a woman who was sexually abused. Well, guess what? How do you make yourself unpleasant and unwanted? You gain weight. You are fed as a mode of keeping you quiet as a child. So when you need comfort and peace, you eat. So those are the emotional components that all of us have to one degree or other. What motivates each one of us is quite differently. Then you have metabolic issues.
So everybody has their own personal story.
Correct.
And they'll have to overcome their own personal
Emotional component.
Their own emotional cause.
Correct.
And through hypnosis, and there are dozens of techniques of hypnosis, but using a different or 2 different techniques every week, we can help people
facilitate,
move through
correct,
those emotional causes.
Mm-hmm. And then the other is metabolic. You know, you have to make sure your thyroid is working properly. Dealing with anti-aging medicine, human growth hormone. It is a fact. I was actually amazed when I went to a conference and they had 2 large screens and there was a cross-section of a CAT scan, abdominal CAT scan. This was 1 year apart. The difference was human growth hormone treatments. And the first one, the person was markedly obese. You could see the fat. It looked like a strip of bacon. 1 year later, it was lean. So
just by correcting
a metabolic deficiency. As we get older, we make less hormones. And guess what? That triggers the problem. Now, women manufacture more estrogen than men, right? Estrogen stimulates the adipose tissue, the fat cells. This is why when you see extremely severe men, extremely obese men, and they're huge, they start to get almost like feminine qualities. Their skin changes. They start to develop a baby face because they're estrogen dominant. So you have to look at their hormonal component and where are they? It's fascinating. It's not just taking a shake or restricting your calories. There are other factors that need to go into holistic. You have to look at the whole package and see what it's individualized.
I believe that obesity, because people know how to treat obesity.
Correct.
You have to eat less or exercise more. It's pretty simple.
Right.
But something is preventing most people from doing that on a sustained basis.
Well, the reality of it is it's happened to all of us. We lose the weight, then we gain it back. Well, why are you gaining the weight back? Because if you reduce your caloric intake and exercise, of course you're going to lose the weight. But you have to address the underlying problem to correct the defect.
And the underlying problem most of the time is going to be somewhere in your background, in your subconscious.
It's going to
your
be
subconscious component of your brain, which actually is about 88% of your brain. Your conscious part is only about 12%. So while you may want to lose weight consciously, subconsciously you may not want to. And that's how we address the issues
The emotional
through
component.
hypnosis. We go right to the subconscious and we instill better behaviors, better choosing your food, better wanting to lose the weight, and removing some of the blockages. Obesity is really a disease of the subconscious preventing you from losing that weight. It feels comfort in having that weight, your subconscious part of your brain. Adrienne, we brought you here for a reason. Adrienne used to weigh over 200 pounds. She's written a book on how she solved her own weight problem. Gus, why don't you introduce Adrienne? Tell us a little about her story.
Adrienne Ware is an author, and we met a few days ago, and she shared with us her interesting life and story that got her to this point. For the time constraints that we have, I'll put it in a few sentences, but essentially Adrienne found herself in a business situation that was horrific. Financially, it was a mess. Had personal problems with illness, with her spouse, and all of these things just put her in a situation where she gained her first 70 pounds. And from that moment on, it was downhill and continued to gain weight until she was weighing well over 250 pounds. Then something happened to Adrienne. She was in the emergency department with her husband who was ill, gets a phone call that her son is basically dying. She has to run to the hospital. She sees him there. It turned out that he was coming through, but when she saw the condition that he was in, she collapsed. She fainted. And that was the sentinel moment. From that moment on, she took a different view on herself, her self-image, and what she wanted to do with life. And ta-da, here we are.
Well, I didn't want to be picked up with a crane.
How much did you weigh at that time you collapsed in the emergency department?
242 pounds of dead weight.
And how much do you weigh today?
Well, I'll go between 120 and 128.
So you
And tell us, how tall are you?
Well, I admit to 5'5", but I'm actually 5'4" and 1/2. I could never
Okay.
get that
You
other half
lost
there.
50% of your body mass. And I know in your book there are photographs of you before and wearing the big baggy pants. And I'm sure we'll all share those pictures. But tell us some more of the
I'm
story.
actually over half because,
Yeah, it was like about 130 pounds, yeah.
yeah, over half my body
It
weight.
was the psychological issues that happened in your life, in your marriage, that caused you to gain 120 pounds.
Well, it's just like he said, because as a child, I had been sexually abused, and so I turned around and felt subconsciously that if I could turn around and make myself unattractive, I didn't realize it at the time, but if I made myself unattractive, then nobody would bother me, nobody would come near me.
Sure.
So therefore,
That was your
it was my strategy on how to keep people away.
It was your safety net.
And then I was even worse because I wanted to be a recluse. So I literally, when I got through all of these business problems, I moved to an island with 350 families and became a hermit. And I stayed that way for the next 15, 17 years of my life.
Just eating.
just eating and doing nothing unless it was for my children. I stayed in the house unless it was for my children. Took them to school, took them to whatever they needed to do, and if it wasn't for that, I sat on a couch. I didn't go anywhere, didn't do anything.
So you were emotionally crippled by these events in your life.
Completely.
And
It was like being comatose.
this episode with your son in the emergency department changed your outlook. And
Made
you
me-
did that all by yourself.
It made me snap completely out of it because I felt that if God was kind enough to give back my child, that I had a debt to God to turn around and repay him because he wanted us both to live. Because I was going to kill myself. If my son died, I was going with him. And so when he gave me back my son, then I had to turn around and start living my life again. Simple.
That's a very powerful testimony to changing your life around. Most people are not faced with these life and death decisions, and but I'm sure many of them suffer as you have with being overweight. Now, have you tried during those 17 years to lose weight?
Over and over and over again.
How many times did you try a diet?
Oh, please. I tried every diet. When those magazines came out and said, lose weight, oh, yes, I'll try that one. And I would be on them a week, 2 weeks. And when I gained, lost an ounce, and who the heck can stay on a diet when you see no results? Then I went to, won't say who, but the cardboard food that comes to you at your house. And oh my God, those hot dogs taste absolutely awful. And then you get the sliver of a muffin that's this thick, and you go, and you're starving still. You could eat the whole week's worth of food in 5 seconds because your stomach is stretched out like whatever. But with me, I ate foods that literally took more calories to digest than the amount of calories that were in them. So the more I ate, the thinner I got.
As you got better, when you
Right.
got when you decided you wanted to live and live better,
Right.
you learned how to eat. You
I
wrote a
always
book
knew.
about
That's the
your
worst part. I
experience.
always knew because I had been a model, so I knew how to eat. I was a nutritionist, so I knew how to eat
It was your subconscious blocking you from
from doing it.
being healthy for 17 years.
Right. For
And it
17
took
years,
you
I sat there
7
eating carbohydrates. I ate cream sauce and pasta and cheese and, the more butter, the better.
you ate to satisfy your subconscious,
Right.
and
And I was hungry. I mean, I was starving.
you are looking at the panel of doctors that are going to be running the Hypnosize project, and we are looking for 6 people to volunteer. Adrienne is going to help you with your emotional issues. I and Dr. Arojo will be doing the hypnosis and acupuncture. We're going to work through your issues, work through whatever is holding you back from long-term weight loss. You lost your weight. You wrote your book 5 years ago?
2008, I was working on the book. I
2008.
published it in 2010.
So you've been at this low weight now for 5 years, 6
Yes,
years.
which is not norm. Most people gain all their weight back in a year.
Within months, a lot of them.
Yeah.
So for 6 years, you're staying healthy
Because the secret is to find out what your inner happiness is. And once you do that and you work at that, you will no longer be hungry for food.
when you remove that blockage in your subconscious,
Correct.
you can find that inner peace
That's what you need, the inner peace.
and that inner happiness, and then the weight will just naturally be normal.
I just heard from somebody, I was over in England, and I went with this lady to a hospital, and her uncle was dying. And I said to him, would you like to hear my new song? Because I'm a singer-songwriter. And so he wanted to hear my song. So I sang my little song to him. And when she went to visit him, he was so happy that I sang to him. And he was telling her, you know, oh, the lady that came and sang to me. So he died. But he was so happy that I came and visited and sang to him. And, you know, that's what I was put on this earth to do. I'm an entertainer, and I did that. So that's it.
And what's actually quite fascinating, and you know, this is the key, there is an emotional stumble block that we all have to overcome. Some are more serious, and like as in your case, others are not as serious. But unless that is unlocked, the subconscious will work against you and will have you reach for the wrong things.
Definitely.
And with the Hypnosize, this is the project. We're trying to get, everybody's going to have their own situation, and they'll become aware what is that core problem that they have, which will be different. We're all individuals. Everybody has a different reason.
And we will unlock that
And
blockage.
that is the goal,
And
to
so
unlock
many
that.
people are fighting what they're actually wanting to do. I mean, subconsciously they don't realize it, but they're fighting what they really want in life.
Correct.
And that's why they're sitting there stuffing their faces full of food, or like you said, they have a drug problem or
Correct.
an alcohol problem
Correct.
because they're so unhappy.
Because it's a comfort zone.
Right.
It's a coping mechanism.
Right.
So coping mechanisms could be anything, whether it's food, alcohol, drugs,
Something to numb them.
something to numb them. And that's where,
I'm so fascinated by this conversation, and I need to continue it, but I want to first discuss about some of the comorbid medical issues. People who are obese, cardiovascular, Gus, name 2 or 3 things.
you name any body system and obesity affects it. In a very short sentence, insulin resistance, metabolic syndrome. You develop hypertension, there's a 30+ chance that you're going to be getting either high cholesterol or diabetes. Once you have 2 of those, the third one's headed your way. Diabetes, what's happening? Your pancreas makes insulin. It tries to lower blood glucose. You imagine you have a hallway with a lot of doors. Try to open the door, nothing happens. They can't get the door in. Pancreas sends another insulin to try to open the door again, to get the glucose into the furnace inside the room. It's not happening. Then 3, 4, 5, 6 insulins come in, they break the door down, and insulin comes in and allows the glucose to be burned. In the meantime, all those other insulins that are out there, they're floating around, they go to the next room and they're doing something that's not very nice. Their second job is to tell the fat cells to get bigger. This is why you get 100 diabetics, and when you look at them, if they're overweight, it's a type 2 diabetic. Insulin resistance is the hallmark of type 2 diabetes. The ones that are very, very thin are the type 1s who make no insulin. So they don't have that extra insulin telling their fat cells to get bigger.
So being overweight causes diabetes.
Insulin
through
resistance.
Insulin resistance.
Resistance, that's one
It
mechanism.
also causes heart attacks.
Because now you have all this excess fat and the hardening of the arteries, and glucose becomes an irritant, the byproducts of glucose metabolism, you're not getting rid of it. Now the blood vessels, cardiovascular system starts to get damaged. Now you're looking at heart attacks. Now
And
you're
then
looking at
heart
strokes.
failure.
Heart failure, heart attacks.
And blood clots.
Loss of sight, the #1 cause of non-traumatic eye loss in the United States, it's usually diabetes, same as amputations.
And neurological, it's associated with dementia and migraines.
Neuropathy, the nerves die. So now you have nerve damage, and people have constant burning pain as a result of their
You have
neuropathy.
depression
Of course,
and the social stigmatization,
definitely.
which caused you to move on to an island for 20 years.
Yeah, well, yeah, not only that though, but I was told I had diabetes and I refused to take insulin. I just ignored it. I had cholesterol problems, high blood pressure.
You know,
So
metabolic
you,
syndrome,
you
syndrome
had
X.
all of these.
She had the syndrome X.
There are many dermatology findings of
The only thing
darkening of the skin.
I do have, and I have always had this since I was like 18, I have thyroid problems, but I have a slow thyroid, but I've always had that.
Now, the one that scares me the most is the association with the cancer, oncology. There's been reported esophageal cancer, colon cancer, pancreatic, endometrial, kidney, melanoma even has been reported in associating with being overweight. The breathing, you have sleep apnea and difficulty breathing.
Restrictive lung disease. You're
Oh,
so
I
big,
did.
your
when
lungs
I was so
can't.
big and fat, I'm sorry, obese.
Yes.
I say fat in my book.
And then
but I
neurologically,
snored really bad.
we have erectile dysfunction, incontinence, and there's so many medical comorbidities associated just with being obese. And as Adrian can attest to, when you lose the weight,
Sure.
you get better.
Oh,
Well,
when they tested me, after I had lost the weight, they said, well, there's no evidence that you ever had diabetes.
Well, this is what happens. Folks that have bariatric surgery, they come in, they get their surgery, they lose 100 pounds, they're off their diabetic medication, they're off their cholesterol pills, they're all
Blood pressure.
Their blood pressure.
Time is running so short. I just have last words, Adrian, for our audience. Tell them they should participate with Hypnosize, lose that
Well,
blockage.
they should meet me because I'm fun.
And they should meet you because you're fun. I think that's the best one yet. Dr. Rojo, have you any last words?
Well, I'm not as fun as Adrian, but I look forward looking.
I'll testify. You're fun.
I'm
You're
fine,
okay.
I will look forward to work with the candidates that come in and expose them to the acupuncture component, and it's really exciting. I think this is something that's unique that I don't think anybody has ever offered, and I hope Oprah's watching because this could be big for you, Jack.
Well, maybe Oprah can join us.
That's right. I'll be Oz and you be Dr. Phil. How's that?
I want to say one thing. I think that this is a different way of doing it and a way that you could keep your weight off, because look at me. We're talking about somebody who has kept their weight off for years.
For years, and that's a secret, and that's what we're striving to do. If you do not eat, you will lose weight. That is a medical fact. It's how to keep it off. That's
How
the secret.
to keep it off.
Long-term, slow, healthy weight loss. We're looking again for 6 volunteers to participate in losing weight. The program is called Hypnosize. If you feel you're a candidate to lose weight, send us a letter, a fax, a video, a text. Get our attention some way. The information will be on the screen. We want you to be part of this pilot weight loss program. We will choose the candidates for participation in the Hypnosize pilot program on February 14th, Valentine's Day. It will consist of 8 weekly sessions. You'll have to participate and cooperate in all 8 sessions. Send us your story, why we should choose you. As we discussed here, the intent is to show you, the audience, that obesity is a serious disease, that one suffering from obesity should be both hopeful and fearful. Fearful from dying, fearful from getting diabetes, fearful from heart disease or cancer, fearful from leaving behind your loved ones. There is hope in reducing the weight, and your weight can be dealt with by dealing with the subconscious, resolving the issues from your past, stopping the food binges, stopping the comfort eating, thus living a long time, and you'll be living at your ideal weight. 6 people who submit your essay or video or otherwise respond to our inaugural series will be the first to benefit. They'll lead the way for future groups to get healthy. Act now, don't hesitate. If you know someone who can benefit, you can go to the metvweb.com website. You can link to their YouTube channel and watch this show with them. You can surprise them with an intervention. Their life may be saved, Your loved one living longer will also be your reward. I'm Dr. Jack Jolwitz, thanking you for watching today's edition of Health Matters, and we hope to see you soon. Thank you both for joining me today.
Thank you.